Healthcare is constantly evolving, and yet for decades the places people went to receive healthcare, known as sites of care, hardly changed at all. Hospitals and physician offices remain the norm, despite the promise of innovations like telehealth and retail clinics. Before the COVID-19 pandemic, there were forces shifting care away from traditional settings, but changes were slow. The pandemic sparked a new era of rapid change. By forcing patients to seek care outside traditional sites and compelling healthcare providers to use new modes of care delivery, the pandemic accelerated the move away from traditional sites of care. As we emerge from this period, healthcare is at a turning point. Many patients and providers have experienced firsthand the benefits of alternatives like virtual care, and they're unwilling to go back. Recognizing that old models are no longer sustainable, healthcare stakeholders must pivot because the healthcare ecosystem has fundamentally changed. Other industries have experienced how changing services can upend established norms. Consider the disruptive power of companies like Uber or Netflix. Just like their disruptive power, site-of-care shifts will change the landscape of healthcare as we know it. To successfully navigate this change, businesses and stakeholders within healthcare must first understand it. This course will explain the ins and outs of site-of-care shifts, the driving forces behind them, and their impact on the entire healthcare ecosystem. Understanding these things is key to both navigating the risks and capitalizing on the opportunities of site-of-care shifts. So let's not waste any time. First, let's define a few terms. Historically, the hospital and physician's office have been the primary sites where patients received care. We'll call these settings traditional sites of care. Many types of care are now shifting away from these traditional settings to places we'll refer to as alternate sites of care, like ambulatory surgery centers, retail clinics, and even the patient's home. A wide range of drivers are prompting these shifts. There are two main types of drivers: national drivers that initiate site-of-care shifts across multiple regions, and local drivers that influence how fast shifts occur in a community. At the national level, advancements in clinical techniques and technologies, plus changes in payment and regulatory policies, are both key drivers. Let's look at these drivers more closely. First, clinical advancements act as a driver by making it possible to safely deliver more care outside the hospital. So safe, in fact, that health plans can shift payment policy to reimburse new procedures outside the hospital, particularly government-funded public health plans like Medicare. Both these drivers prompted shifts to alternate sites of care nationally by enabling care delivery outside of traditional settings. On the other hand, local drivers influence the speed at which local shifts occur. Key local drivers include provider, patient, and payer preferences. By payer, we mean anyone who bears the cost of health care, including health plans and employers. Provider preferences, for example those of surgeons or nurse practitioners, can often increase the number of non-traditional care sites available locally. For instance, an independent or non-hospital employed surgeon can decide to leave a hospital and invest in an ambulatory surgery center where she will also treat patients. Her choice to leave the hospital and work in an alternate site creates other local site options available for patients. With more options available, patients are empowered to choose a non-traditional site of care that offers greater convenience and often lower costs than traditional sites of care, thus shifting care. This is where patient preference comes into play as a driver. When choosing where to get care, a patient with access to various sites will usually prioritize convenience and lower cost. This accelerates care shifts away from traditional sites like the physician's office and hospital, which almost always entail higher costs, longer waits, and less convenience. To be clear, this doesn't mean that a patient will always veer away from traditional sites of care, or even that it's always an option. In the case of more acute injury or illness, the hospital setting may be more appropriate. But, by and large, patients will choose the most convenient, low-cost option available, and this shifts volumes away from traditional sites of care. The final local driver is payer preference. In general, payers employ strategies called steerage, sometimes referred to as navigation, to encourage the move away from traditional sites of care. This is because for many procedures, the hospital is the most expensive place to get treated. Thus, many payers prefer that their members and employees receive care in non-hospital locations whenever possible. Now that we understand what site-of-care shifts entail and the drivers behind them, let's look at an example of how these shifts play out in real life. Meet Steve. Steve recently fell off his bike and badly hurt his knee. He needs to see a doctor as soon as possible. In the past, Steve likely would have gone to the hospital emergency room and waited in line for hours. Now Steve can go to an urgent care center close to his home, be seen quickly, and get the care he needs right away. This demonstrates a shift in care from the hospital to an urgent care center. What difference does this shift make to Steve? Well, the growing availability of more convenient sites like urgent care centers have made treating his knee faster and more cost-effective. Instead of paying more for emergency hospital care, which can be up to 10 times more expensive than an urgent care visit, Steve gets more timely and lower cost care outside the hospital. Steve's situation is just one example of a common site of care shift, but this trend is playing out in many other ways across the healthcare ecosystem. Let's delve deeper into the 5 major shifts occurring today.